Okay, so I'm Shakira, and if I had my T00 number, I would be saying this for the opener. And today we're going to be doing a mock epidural. I've got my patient here who is a stuffed sheep, and I have my printout of the skeletal spine, so from L2 all the way down to the sacrum. We've got the hips here, so you're going to have the same printout that hopefully will be the same size, and just attach it to the back of your patient. The legs are forward like they should be, so we're opening up the sacral space. And I have my preps, so chlorhexidine scrub and some alcohol for a final prep, and my clippers. So I'll pretend to shave a space. I'm not going to scrub my actual printout because the dye will run, but I'll just pretend to shave a little square. Depending on how big your animal is, it should be at least vertebrae above and below. So I think about 5 centimeters by 3 would probably be good for this patient. So I've shaved my space, and it would be just like you would for a surgical prep. And I'm going to take my chlorhexidine scrub, and I'm just going to scrub down here, so whatever is easier for yourself. The first one will be just a general scrub where you're getting all the dirt and debris off, and there's no real good way to do it, but you do as many as these as you need. Usually 3 is good until your sponge is clean and there's no further dirt or oils. So we'll say that's a good scrub for the first one. And then we take our sponge and fold it so that there's the clean area out here. We're not going to touch that. We'll pretend that the space is here. So I'm just going to do my prep and turn and go around. And for the sake of this demo, I'm going to pretend that now I've done 3, and we'll just pretend that this is my final sponge. In the video, you'll have to do the final prep and everything properly. So the 3 scrubs until they're clean, and then the 3 surgical prep, and then the same with the alcohol. So I'm gonna move that. So now our area is scrubbed and everything's good. Our patient is anesthetized and we have someone monitoring properly. I have my drugs over here. I'm not going to do the card printout and the labeling. I do have them labeled, but for your video, there's specific instructions on having a card and your calculations and all of that. But I am going to take my sterile gloves and let's see, I'm just gonna move this here. So in the video, there's 2 different ways that you can do it, which is either the way I'm going to do it, where I'm going to have a sterile field with my gloves. But I would suggest, if you're not confident with opening your gloves and putting the supplies in there and keeping them aseptic, that you get an assistant to hand you your supplies in an aseptic manner. So I'm going to open my sterile gloves here. All right, so this will be my tray. You can touch the outside of the gloves and open them on the tray without touching the inside. All right. And this is my spinal needle. So this one's a little longer. If you have one that's longer than suggested, that's okay too, but this is a 22 gauge by 2.5 inches. And I'm going to open this aseptically. And I'm going to drop this onto my sterile field. Again, not touching anything. And these are my drugs here. So I'm going to now put my bupivacaine and my morphine into my 6 ml syringe. So I'm just going to remove that. So my patient is a little larger than the one that you're going to do for the mock. So the amount of fluid I have in my syringe isn't going to be the same as what you should have, just as a side note. So you will have to show your calculations. And again, in the video, Ashley in the demo, the real one, she uses an assistant and draws the drugs right out of the vial. So you can do it that way as well as you like. I'm gonna leave this, and it's gonna be my sterile saline for the hanging drop technique. So I'll put that aside, and I'm gonna put on my sterile gloves. All right, so everything should be in range of your patient, so you're not knocking into things. I'll move this out of the way, and I'm gonna just go on first. I'll move my needle out of the way. Okay, so got this. So this is going to be my dirty hand or off hand. So I'm going to touch my patient, and once I've done that with my off or dirty hand, I'm not going to touch the sterile field again. So at this point, if this isn't in the way of where you can easily grab it with your clean hand, then you should move it. I'm going to palpate. So here I've got lumbar spine 2, 3, 4, 5, 6, 7, and then that's the sacral space. These are the wings of the ilium, just like you'll do in your palpation lab. You can use these 2 fingers or these 2 fingers, and then you'll just go down and you'll feel the space. Your finger should dip in. So right there, it should dip in. So that's gonna be my spot. And I can come back again and find it, but now I'm gonna get my needle. I can take this off. I just can't put it back in here if I'm going to use that again. So that now goes here. This has a bevel, and depending on which area you're wanting to have the pain and the anesthesia go to, sometimes if it's farther up, like an abdominal procedure, then the bevel would go facing upwards or this way. So I'm going to do this facing upwards. I'm going to find my spot again. So here, and I'm going to go in on about a 45 to 90 degree angle and right into the space here. So going in, and I'm going to stop right when I get into the skin and take this off. So I didn't touch the hub with my dirty hand. I only touched down here. I'm going to put this aside with my dirty hand still. I'm going to pick up my saline. And now from now on, I have to be unsterile, but I'm not going to touch this hub with my dirty hand after I make this one dirty. So this is sterile saline. I'm going to put, holding this here, a drop to fill this. And then if you are in the right space, when I put this through the skin, we can pretend that I hit the right space and that saline got sucked into the epidural space, and we know we're in the right space now. So now I can take my drugs. Again, I'm not gonna contaminate the hub openings. I'm only gonna touch here, and I'm gonna put my needle here, and I should be able to easily inject without any tension or resistance, all of the drug in. So this is about as slow as you have to go. I wouldn't go any faster or slower. And then when you're done, you take that and pull it out and you're done. Just as a note, if when you have the saline in there or before you put the saline in, if you notice any fluid coming out of the needle before you put the saline in, that would be CSF fluid, and that would mean that you're not in the epidural space, you're in the spinal space. So this has now become a spinal instead of an epidural. So for the purpose of this assignment, if this was not mock and you saw that, you would most likely pull it out, but you could ask your doctor if they're okay with it being spinal now instead of an epidural, in which case usually you would give half the drugs. But you do want to look in the hub and make sure that there's no fluid, there's no blood, there's nothing before you put that saline in. And when you go to attach the needle and give the drugs, there shouldn't be any blood or anything in there, because it's a little easier on your stuffy to do this, but when you're in the right space on a real animal, there's a little bit more resistance, so it's harder to push it in by accident. So now that we're done, we would just pull this out and place it aside, and that would be it. Thank you.